Welcome to High Performance CPR, an update to the Toronto Fire Service's 2014 defibrillator program. High Performance CPR is a series of tips and techniques you already know that will improve cardiac output in CPR and has the potential to improve survival. Participating in High Performance CPR is part of participating in the ROCK cardiac arrest study. Part of the ROCK cardiac arrest study is a head-to-head comparison of CPR techniques, and on May 1st, 2014, we're going to be switching from the conventional 30-2 CPR to the continuous cardiac compressions, or CCC CPR. We already know that high-performance CPR maximizes the blood flow to the brain, the heart, and other vital organs. Toronto Fire Services participated in 116 saves in 2013, and when the defibrillator announces a shockable rhythm, there's a survival rate as high as 28%. High-performance CPR begins with a rapid initial assessment. When you approach the patient, assess their level of responsiveness.
Definitely unresponsive.
If the patient is unresponsive, one rescuer turns on the AED, while the other rescuer simultaneously checks airway, breathing, and checks for a pulse.
9, 10. Patient's VSA, going to start CPR.
If there's no pulse, begin chest compressions. Apply the AED pads as soon as you're ready.
Yep.
Okay, continue.
And then ventilations can begin once the bag valve mask is assembled and connected. The next step in high-performance CPR is to ensure you minimize interruptions to chest compressions.
Stop CPR. Stop CPR. Don't touch patient. Analyze.
You should only be interrupting chest compressions to analyze the heart rhythm, to rotate compressors every 2 minutes, and you only interrupt compressions to switch to the EMS defibrillator once your defibrillator announces stop CPR analyzing heart rhythm. Starting May 1st, 2014, you'll be performing CCC CPR, or continuous chest compressions. That means no more pauses for ventilations. The breaths will be given on the upstroke of every 10th chest compression.
Good depth, excellent depth. 10, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3. Good depth, excellent depth. 10.
The next important step in high-performance CPR is to ensure an adequate depth of chest compressions. You do this by watching the depth gauge. Each compression needs to be at least 5 centimeters or 2 inches. Listen for the voice prompts. If the depth is not sufficient, you'll hear push harder. Once you achieve a sufficient depth, you'll hear the good compressions voice prompt. Be sure in high-performance CPR not to rest on the chest, or what we call camping. Allow full chest recoil. It's during chest recoil that blood returns to the chest for the next compression cycle. Finally, you have to ensure an adequate rate of chest compressions. Chest compressions are delivered at 100 to 120 compressions per minute. Listen for the metronome and follow the beeps of the metronome to reach 100 to 120 compressions per minute. The next step in high-performance CPR is to perform CPR during charging. That means that when the defibrillator announces stop CPR analyzing heart rhythm, you'll briefly back off the chest and hover your hands near the chest in preparation to resume CPR. When the machine announces shock advised, then briefly resume chest compressions until it says press flashing shock button. Then everyone clears the chest briefly while a shock is delivered. Finally, in order to provide high-performance CPR, we know CPR performance drops off after every 2 minutes of CPR or so plan to rotate chest compressors during the analyzing heart rhythm. Improved CPR is leading to improved survival from cardiac arrest in Toronto. Switching from 30-2 CPR to CCC CPR is allowing a head-to-head comparison of the different CPR techniques. By participating in the ROCK study, Toronto Fire Services is helping to design the CPR of the future.